and welcome to this presentation on narrative therapy. So narrative therapy centers around the idea that people are the experts of their own lives, and this therapy technique in particular views problems as separate from the individual. Here, issues are not restricted within the clients, but are rather influenced by what's around them. It's founded on the idea that people have many narratives contributing to their identity, and it assumes that they have the skills, competencies, beliefs, and values to help solve their own problems. It centers around an engagement in restoring a client's narrative by reconsidering, reappreciating, and most importantly, reauthoring the client's preferred lives and relationships. So this therapy technique was first developed by David Epson and Michael White. And a narrative therapist is described as a licensed mental health professional, social worker, or therapist who has additional training in narrative therapy through academic programs, intensive workshops, or online continuing education. Narrative therapy is used by psychologists, family therapists, community workers, and dietitians can even translate some of these aspects into practice, but they won't actually be qualified as narrative therapists. So when was narrative therapy introduced? Although first developed in 1980, the history of narrative therapy can be considered in three phases: the days of the psychoanalyst, and then the succeeding waves of family, and then finally narrative therapy. Psychoanalysis promoted a settled view of the workings of the mind and emotions, so it was very much about the mind and its subconscious, and sessions were often led by the therapist. Family therapy broke the psychoanalytic idea, focusing just on the inner workings of the mind, but the idea of master therapists still prevailed. Narrative work took this change a crucial step further and shifted the power from the therapist towards the patient. The main difference between narrative therapy and other therapy options is that in narrative therapy, the patient leads the session, and it's structured in a storytelling way. And again, it assumes that people have the skills, competencies, beliefs, values, and commitments to allow change. Because of its in-depth nature, it's better suited for one-on-one consultations and can be applied to dietetics when a patient's diet is not influenced by individual factors, but also broader factors relating to their lives. So let's talk about how narrative therapy actually works. So first, the counsellor gives the patient attention to talk about their concerns, and then the therapist accepts these descriptions while also assuming it's unlikely to be the whole or only story. The therapist then asks clarifying or extending questions to describe the difficulties in more detail and to clarify the effects of them. Next, the patients are encouraged to give names, a single word or short phrase to describe the problem, for example, depression or stress. This enables the person to feel more in control of their problem and gives a precise definition for externalization of the issue. Externalizing language is used to separate the patient's identity from the problem. An example would be to say, depression invaded your life, versus you became depressed. This is followed by asking them when they last had the upper hand over the problem. The patient is then invited to take position on the problem, and this is where therapy reaches its turning point. They either decide to remain dominated or can decide to take into account the richer story that the therapist has encouraged them to tell. The use of therapeutic documents summarizes the patient's discoveries and describes the person's perceived progress. And therapy ends when the patient decides that their self-story is rich enough to sustain. The final session can be organized as a joyful occasion, and the patient may be presented with a certificate to mark the occasion. We will now explore the use of narrative therapy in dietetic practice through an interview conducted with accredited practicing dietitians, Tim and Megan, who both have their own private practices in which they coordinate one-on-one consultations. The interview had pre-planned open-ended questions, and they started off general, inquiring about the rapport building with patients, but then more particularly focused on the aspects of narrative therapy. The key findings from the survey were that both dietitians followed an approach similar to narrative therapy unknowingly, and that narrative therapy constitutes a big part of the HAZE approach, which I'll discuss more on later. It's useful in diagnosing patients with eating disorders, and certain limitations do exist when implementing this into practice. Both dietitians claimed that they use narrative therapy in practice, even though they weren't necessarily aware of this counselling technique. The reason why it may be so innate, according to the interviewees, is because understanding a patient's story is crucial before any intervention plan, and counselling should be patient-focused anyway. To meet the patients with where they're at, you need to understand their background and work with them so they can eventually feel motivated enough to narrate their own story and not be shaped by their past. One of the dietitians integrated narrative therapy into the practice through a HAES approach. HAES is a weight-neutral approach to health, and practitioners believe a focus on healthy behaviours rather than a focus on reducing body size is the most useful way to support people of all sizes to take care of their health. It involves focusing on replacing negative ideas with positive ones, with an emphasis on patient-focused approaches and individualizing care. The key aim is to make patients feel in control of their lives so they can reshape their story. So you can see that the key principles of narrative therapy underpins this approach. Another use of narrative therapies is in diagnosing eating disorders, which cannot be medically diagnosed if their story has not been told, as it is so heavily impacted on other psychological and social factors. Patients with eating disorders often need more time to open up due to the range of psychological influences behind their eating behaviours. Hence, this is a perfect opportunity for narrative therapy, which centres around the idea of storytelling. Although frequently used and almost innate to the interviewed dietitians, narrative therapy is not always easy to integrate into practice. As it is quite personal, a one-on-one consultation is most suitable, but this can limit its transferability to the broader dietetics field of group intervention, where less personal or invasive approaches such as behavioural therapy would be used. Also, in hospital settings, patients are often too unwell to tell you their full story, and so you'd ask more direct questions addressing the key aspects required for dietary intervention, which is most likely to be a short-term goal. Patients are then referred to a practicing dietitian in the community to address their long-term dietary goals. The interviewees provided an insight on how to integrate narrative therapy into practice. Encouragement plays a large role here. The dietitian must enable them to see that food is neither good or bad, and that you are here to help guide and support them rather than to judge. Saying that you are not the food police may help them feel more at ease. This leads to the next point of discouraging negative thoughts and looking for positive ones. The dietitian should reinforce the patient that they have the power to control their lives. Viewing areas of improvement, for example binge eating, as things that they can work on rather than labeling these as negative aspects of their life changes the mindset and helps them feel more empowered and capable. This is similar to externalizing the issue, which I addressed earlier. Personalizing dietary interventions and emphasizing that you are here to meet them where they are also makes them feel more comfortable in disclosing their story, as they won't fear the need to meet expectations. Sticking to open-ended questions increases the chance of patients opening up. This then allows the dietitian to explore the background behind their eating patterns. Encouraging family members to accompany them to consultations can not only make them feel more relaxed, but it also enables the dietitian an opportunity to build rapport by asking about the culture. They can research about this later, and patients will value this and will be much more likely to return. And of course, this is a big part of successful behavioural change. Last but certainly not least, being empathetic shows the patient that you care and that they can trust you to help them in rewriting their narrative. Next, we looked at the applications and research for narrative therapy, where we conducted a literature review. The review reflects on the depth and different uses and applications of narrative therapy, defining research studies within the dietetics research area. The research found that narrative therapy includes areas related to nutrition, dietetics, and health, and excluded any articles unrelated to those. The aim was to search and explore the range of articles related to the uses of narrative therapy within the dietetic setting, and to summarize the results to determine the applicability and effectiveness of the counseling technique in practice, as this area within the dietetics field is relatively small and often narrowly directed at specific areas. We use the databases Medline and CINAHL to search for relevant articles. We use different keywords to maximize findings, but just researching narrative therapy alone found over 300 articles, which in our case were too many and may have been irrelevant. Using keywords such as health, nutrition, and dietetics allowed us to find more articles relevant to us. These are the 4 articles we thought best suited the analysis for narrative therapy in research. This article explores the efficiency of group work that uses narrative therapy for eating disorders and depression recovery. The study was set in a community-based setting where the use of narrative therapy focused on the facilitators using co-research with the participants and acknowledging their experience and knowledge. The participants mentioned some of the narrative therapy approaches as further supporting change. This involved externalizing and determining the causes of the eating disorder. This next article explores clients undergoing the use of narrative therapy in a university hospital with child and family in the outpatient setting. This reveals their opinions on the experience of narrative therapy, more specifically, what they thought helped. The understanding of what helps them can determine modifications in current practice. The third article determined if narrative therapy would enhance the effectiveness of both body image and eating disorder issues. They found that narrative therapy has been established as a valuable way of treating those who struggle with body image dissatisfaction and eating disorders for middle-aged women. Finally, in the fourth article, it summarized that utilizing narrative therapy along with archetypal metaphors provides a method for the patient to explain their own storyline while using the image of symbols. This is used as a means to help women progress through the stages of change. This is done in hopes to empower women taking appropriate control of their health. The 4 articles that were found consisted of studies looking at narrative therapy in treating eating disorders and depression, those in children and family hospital settings, women with body image and weight issues, and in the delivery of intensive care in nutrition. Results that emerged from the articles in regards to the application and effectiveness of narrative therapy included that it had a strong positive effect and that it was used as a way to help progression through stages of change. Also, some women with eating disorder issues also identified some narrative therapy approaches as supportive to change, as well as being seen as a valuable means of treating women who are struggling with body image issues. So the key similarities were that all 4 articles are related to similar areas within dietetics, that being eating disorders, and that using narrative therapy provided an overall positive experience for patients. The difference, however, varied from rural community health to a university hospital setting. In conclusion, narrative therapy was found to be positively effective and valuable in individuals who are struggling with certain issues, as it was seen as a good means of expressing and progressing with themselves. However, there is a need of greater research on narrative therapy in the use of dietetic practice, as a large majority of the research within the review was found to be related to only eating disorders. Thank you for tuning into this presentation on narrative therapy. We hope you have enjoyed and learnt something new. See you next time.